So, when you're pregnant, has anyone ever told you it might not be safe to travel? Have you ever wondered if it's okay to travel via air, like to get on an airplane while you're pregnant? It can be kind of difficult to find all of the answers regarding travel and pregnancy, particularly travel on an airplane. It can be a very confusing topic, so that's what we're going to talk about today. Welcome to the Dr. Lexi Show, where I take pregnancy topics and break them down into simple terms to help you advocate for yourself and your pregnancy. I'm Dr. Lexi, a board-certified OBGYN and maternal fetal medicine specialist, which just means a high-risk pregnancy doctor. And today we're talking about airline travel. So as you know, I typically start out with expanding knowledge, then developing skills, and we talk about the impact we can have on your life and the life you are creating. So today I want to point out that you can always leave any comments below and let me know of any other topics you'd like me to talk about in the future. Again, today we're talking about travel, particularly airline travel during pregnancy. Don't forget you can always check out your free download, drlexihill.com/advocate, and this is going to be 13 questions that you can ask your provider in general for any pregnancy. Also, there's going to be a download that you can get at drlexihill.com/travel. That's going to be a nice little travel checklist for you that includes a few things to look at prior to airline travel. So we're going to begin now with expanding your knowledge. So first, I'd like to talk a little bit about what kind of exposure are you worried about when traveling on an airplane? A lot of people first get a little bit nervous about the exposure when you're walking through security. And so there are some great websites that the CDC offers, and I will include those links for you below. And you're able to check in there and look at the exposure that you have going through security. The information actually states that the exposure going through security with regard to radiation is less than that when you're on your cell phone. So we know that that's a very safe place for individuals who are pregnant going through security with regard to any exposure. Then the next question is, what about exposure on an actual airplane? What kind of radiation exposure is occurring at that time? And the question is it safe for you and is it safe for the fetus that's growing inside the uterus? So what we typically tell people during a pregnancy is that we do not want more than 5 rads of exposure. So if you look on the CDC website, they actually talk about the radiation that someone can get on a flight that goes full cross country, at least for a flight that goes from East Coast to West Coast, so as far as you can go in the United States. The exposure received in the air during that time is quoted as less than 1 chest x-ray. So to put that into perspective without having to get too much into physics here, what is known is that 1 chest x-ray has a very, very, very small amount of radiation. And an individual would have to have over 70,000 chest x-rays before getting close to 5 rads of exposure. So we know that that one flight would be well below, very, very far below, the recommended limitation of 5 rads of exposure during a pregnancy. The thing to kind of know as well is that the higher the altitude and the longer the distance of the flight, the more radiation exposure that someone could receive. So if you are someone flying a very short flight and you're not flying many times during a pregnancy, there would not be concern for excess radiation exposure. Now, if you are someone who travels a lot for work or on international flights that would be going further, or if you work as a pilot or a flight attendant, those would be things you need to check for further information regarding the amount of radiation you would be receiving depending upon the length of the flights, the altitude of the flights, and then the frequency of the flights that you would be taking. All right, then the next question becomes, well, how do I know if it's safe to actually fly? And that's something I just want to make sure everybody is aware of for some expanding our knowledge. So you always need to talk to your provider. So for individuals who have no medical problems in a pregnancy and they're doing just fine, they're just pregnant, no other underlying comorbidities, generally speaking, it is safe for the body to go through a flight. Now, we do know that the oxygen is lower at higher altitudes, so it can be a little bit more difficult to keep up that oxygenation status as you're at a higher altitude. So we actually do know physiologically during pregnancy there are some changes to help individuals continue to breathe at a certain rate so that they don't actually hyperventilate. We call it a relative hyperventilation. So there are changes within the way the diaphragm sits and how the lungs function. Also, the heart rate increases about 10 to 15 beats per minute. Those things being said, when you're at a higher altitude, naturally, because of that oxygen being less at a higher altitude, heart rates will go up a little bit and blood pressures will go up a little bit. There is some data to show that the oxygen saturation, which is like when they put the little thing on your finger and they look at how you're oxygenating, that can drop a little bit when you're at very high altitudes. So they still need more data surrounding this, but in general, when someone does not have heart and lung issues and they have no other comorbidities and they're just a healthy, pregnant individual, they typically do very well with a little higher altitude during a flight, i.e. when the oxygen in the air is a little bit lower. All right, so now we kind of know a little bit about that. So then we get into developing skills. So now that we know a little bit of some base information about radiation exposure and some physiologic changes, now we need to develop the skills on what we can do to actually be sure it's safe for you to fly. So first thing is talk to your provider. So for individuals in flight, it's most risky to fly in the first trimester and the third trimester. So the safe time to fly when pregnant generally is somewhere from around 14 weeks to 29 weeks. That's just kind of a general time. If you're flying in the first or the third trimester, it's always important to talk to your provider. In fact, it's important to ask them at any time during a pregnancy when you're thinking about flying. So always ask them, number one, is the gestational age I am at currently, is it safe for me to fly? And then number two, do I have any medical problems or complications or anything going on with my pregnancy that makes it dangerous for me to fly? Then the second thing is talk to the airlines before you fly. There are some flights that limit a certain gestational age and will not allow individuals to fly after so many weeks. I have seen and heard that this can be sometimes from 34 to 36 weeks, where if you're after that gestational age, they will not allow individuals to fly any further. So before you have that flight, book that flight, call the airlines directly, go on their website, find out if they have any limitations to allowing pregnant individuals to fly. And then once you've talked with your provider and talked with the airline directly, it would also be important to check in with yourself, check in with your schedule, and see where the hospitals are wherever it is that you're traveling. So that's what I always tell individuals. Before you travel, make sure that you know where the closest hospital is that accepts pregnant individuals, where you're traveling, and then make sure you have that phone number with you. On top of that, it's always important to take some records with you. It's good to know your due date, your blood type, and any other medical issues you may have, any allergies, any medications that you're taking. So you can talk to your provider before you travel and make sure you can get some basic documents to take with you on your travels. Then the next thing with developing some skills is what is it that you can do before and the day of your travel? So one of the main things is to stay well hydrated. Very, very important. Another thing, wear loose-fitting clothing so that you don't feel like you're confined while you're traveling. Another would be making sure that you're moving your legs frequently on the plane. So if you're able to get up and walk around every 30 minutes to 60 minutes, that would be ideal. If you're not able to get up that frequently, you can also move your calves by just pointing and flexing your toe right there at the ankle, moving your knees up and down. Anything to get that blood flowing in your calves would be fantastic. And I also do think it's a very good idea to wear compression stockings. These can go just below the knee. It's totally fine. You can get those that go from the ankle to the knee as well. There's a really nice handout that you can get online. It's at drlexihill.com/compression stocking, and you can find some information on how to choose the best compression stocking. You can also visit one of my other YouTube videos on compression stockings and talking about how to measure your legs to get those fitted appropriately. And it would be great to wear those the day that you fly, so before you get on the plane and during that flight. And again, remembering to move your ankles and knees around so that your calves are moving to try to get that blood flow pushed back up and not pooling down in your calves and your feet. Another thing is always make sure that you put your seatbelt on below your bump, and that's an important way to travel on an airplane. Anytime you're seated, you need to make sure to have your seatbelt on. You never know when turbulence could occur. So those are some items for developing skills on the day of and preparing before when you're traveling on an airplane. And then the big question is, what about the impact that we're having? The whole point of what I'm doing with these videos and trying to educate individuals by expanding their knowledge and developing skills is to have a positive impact on you and your pregnancy. It's good for you to be able to know the questions to ask, to be able to know if it's safe for you in particular to travel, and to advocate for yourself so that ultimately the impact you are having is the ability to travel and see those family members, really schedule out as best you can any travel you're going to take, and also to have a happy and healthy pregnancy ultimately. Don't forget to check out drlexihill.com/advocate for the questions that you can ask your provider and also the other downloads that we've discussed in the video. If you have any other questions or comments, please leave them below. And as always, I'm Dr. Lexi, wishing you a happy and healthy pregnancy.